This week's Ask Dr. Durie comes from a gentleman who is very concerned because he developed a couple of broken ribs. And so he has MGUS. And the question with his doctor was, with broken ribs, does this mean that he has now developed active myeloma? And so very, very important, this question. So in his case, he actually had quite a bad fall, fell over backwards against some rocks and broke the ribs in that fashion. And so in this case, where there's been quite a serious trauma involved, an accident, then I think that the development of some broken ribs does not necessarily mean that there has been myeloma. But it means that one needs to look carefully to see, well, maybe were the ribs weakened, or are there any indications that the myeloma has indeed become more active? And so in this situation, I strongly recommend that detailed testing be repeated. One needs to check, is the myeloma protein level in the blood, is that changed? Has that increased? Is there an increase in the blood free lights, the light chains in the blood? Has there been a change in the bone marrow plasma cells? The percentage, I'm assuming, had been quite low, and it might be reasonable to see if there's been any increase in the bone marrow plasma cells. And then, of course, the critical thing is to evaluate the bones overall, and this can be done with a whole body CT scan, or if feasible, a PET CT scan would be ideal to see is there any active myeloma anywhere throughout the skeleton. In this particular case, where apparently the myeloma protein level had not changed, I would expect that the PET CT scan would be negative, except possibly at the site of the healing of the two fractures. And so this is a very important thing just to be aware of. And the bottom line is, please check carefully first and don't just rush in with treatment for myeloma without truly evaluating the status of the disease to see if maybe this was just an unfortunate fall and just additional ongoing monitoring is required to assess the status of the disease.